Welcome to today's discussion on innovation in cardiovascular care.
Yeah, great to be with you today. I am Walid Amara. I am cardiologist. I work in the suburbs of Paris. I did my medical studies in Paris, and I work in a public hospital. In this public hospital, I am in charge of arrhythmias management department and developed arrhythmias management in this area around Paris. And actually, I am the president of the French College of Cardiologists, which is the college that represents cardiologists working in the public hospital, non-university public hospital. And one of our role is to get how the evolution of our job will be in the next 10 or 20 years. And that's something that I really love.
What motivated you to specialize in rhythmology?
That's amazing. That was not planned like that. So to be honest with you, I um, I was at the middle of my specialization or my residency. I went to see one big professor in a big center. This professor was specialized in heart failure. And I said to him, "Oh, professor, I want to be involved in heart failure management. I want to do echocardiography, imaging, etc." And he said to me, "Oh no, Walid, don't do imaging. The future is arrhythmias management. We will have defibrillator implantation, we will have ablation, we will need new people doing that. You have to be specialized in that." After my residency, what I was doing when I started working, actually, I'm doing completely different. So, and I think in the next 10 years, everything will probably change again. And that's amazing.
Could you elaborate on the main challenges which you have in a day-to-day activity?
There are many difficulties. Even and what I say for France is true for Europe in general, probably in other countries as well. First, uh, cardiologists are older and older, and maybe 30% are more than 60 years old. And actually, if you want to replace an old cardiologist, you need two cardiologists because people, life has changed. Young people, young cardiologists, nurses want an equilibrium between their professional life and their personal life. They need time with their family, etc. So that means that we have less cardiologists than we had 10 or 15 years ago, and that we will need 10 to 20 years to get the number of cardiologists we had 20 years ago. And even if we will have the same numbers, we will need more. That means that my life should be organized differently. My working life should be organized differently. And actually, I think that we will not have in the future enough doctors. So we need solution to help our patient to get access to the good information at the good moment and to improve education, to improve the management, for example, of their clinical risk factors. That's very important.
Reflecting on the shortage of cardiologists and specialized doctors, how does this trend, for example, affect nurses?
I am very happy if I have a nurse to specialized nurse on heart failure management, of myocardial management, etc. But unfortunately, there are not enough nurses on a clinical basis, and we are lacking nurses even in the best hospitals in Paris, even in university hospital, will not have enough nurses to do even intervention, cardiac surgery. So that means that we need more nurses, we need more specialized nurses, but we need also all the solution that may help us will be good.
Dr. Amara, the need for innovative patient support is also reflected by the current patient behavior. What for solutions do patients currently use?
Of course, if you need any information, you will use Google and you ask Google, "Oh, Dr. Google, I want to know how can I reduce my cholesterol? How can I improve my health, etc." And the problem when you go to Google, you can find many different information. You are not sure about the source of that. And actually, there is really a need about the quality of the source. The idea, I think, the future will be to have disease per disease, some access to some information. Depending on your disease, it can be diabetes, heart failure, myocardial infarction. So this, for your case, there are some information there on one side, on apps or etc. And then you can find videos and more even.
Dr. Amara, we have now talked about multiple challenges, but also some possible solutions. Reflecting on the overall trends, what motivates your engagement in innovation?
First, my motivation, my patients are my motivation, because we are very lucky that we have positive results every day. We may have some, of course, complications, difficulties every day, but the majority of our results are positive. And every time that a patient say thank you is something putting a coin in the machine, and then you start again and you have energy again to continue. And continuation for me is interaction. And that's why what we spoke to you about my story is that I interact with my patient, I interact with my team, I interact with other cardiologists, with other doctors, or interact with other professionals in other areas around medicine, like we are discussing every day. And what's positive on that is, with this interaction, I wish that we can impact the future. We can impact what would be the modification. When you speak with pharma company, they want to have the best drugs, the best studies, the best evaluation about how to develop their solution. And when we discuss together, of course, we discuss about digital solution that today, tomorrow, or even on the future, we will propose to our patient. And that's a very positive message. And I was very happy to be with you today. Bye-bye.